Thanks very much, Claire, and delighted to be here. And thanks very much to the organisers for giving us the opportunity to speak. I suppose that the focus so far of what I've heard of all the really interesting presentations is about health, the environment, and also food. But the area that I work most closely with is the animal health sector, but the animal health sector in the context of One Health. Because One Health is a unifying, integrated approach. And I think we all have to consider ourselves in the One Health space going forward. And I suppose One Health builds in human, animal, environment, and also plant health. So it's the four sectors when we talk about One Health. I think it's fair to say that recent international health emergencies such as COVID-19, monkeypox, Ebola outbreaks, then we have the AMR challenges, we have food safety, we have climate, we have degrading ecosystems. All those challenges focus the need for a resilient health system and global action. And I just want to present some One Health facts that just join up the importance of looking at the four sectors together. So at a health level, 60% of pathogens or disease-causing agents that we will get come from animals, either domestic or wildlife, 60%. And 75% of new and emerging diseases will come from the animal population. 80% of pathogens that are of bioterrorism concern are also originate in animals. So we have to look at the whole One Health space. In terms of food security, which is essentially food availability, there's huge pressure, and we can see each night there's 811 million people globally go to bed hungry. And we're going to need 70% more additional animal protein to feed the global population by 2050. And as well as that, 20% of our animal population losses are due to disease. If we look at it in terms of our environment, and I put up a picture of those bats, which we're familiar with because of our possible COVID links and also Ebola. But the reality is, as deforestation occurs, we're much more likely to encounter wildlife when up to a minimum of 25% of our forest cover is lost. Human actions have actually altered our terrestrial environments by 75% and have impacted on marine environments by 66%. And then from an economical, financial perspective, animal diseases pose a direct threat to those that are completely reliant on livestock production for food. And then finally, about 75% of the billion people in the world who live on less than $2 a day depend on this small subsistence farming. So what is One Health? And it's important that we understand it because it is a term and it has come up already today. And I think this infographic was already shared. But it is about sustainability. It's about balance. It's about balancing human, animal, plant, and environment. So not looking at them separately, but looking at them together across all the disciplines involved, both from the medical, the veterinary, the animal health, the environmentalist coming together. It's a whole of society approach, regional, national, global, and we mentioned also about equity and access, but it's really built on those three C's. Communication across the sectors, and by communication I also mean education. It's collaboration, it's about joining the dots, each sector not working in a silo, but understanding what our roles are and how we work best together. It's coordinating that effort and it's building capacity. And the end goal is very simply healthy ecosystems, healthy animals, and healthy humans. So what is being done? The One Health space, and it was mentioned about the EU statement from the five big agencies, but at a global level, this is where we are going. Countries are being asked to design a One Health national plan of action. And the basis of that has been outlined by the quadripartite, which is the Food and Agricultural Agency of the United Nations, the UN Environment Programme, the World Organization for Animal Health, and the World Organization for Animal Health. So what they have done is they have developed an implementation guide, and they basically told us how to do it, if you like. So they have said that every country should develop a One Health action plan following these three pathways of change. So the first step is governance. I'm going to talk about how we've built that in nationally now in terms of a governance structure for One Health later. But they're saying you have to have governance and policies and obviously finance, advocacy, legislation to drive the One Health approach. Then you further develop, you have organising and implementation at a sectoral level, and that must be based on data, on science. We've had a lot of science presented to us today, but the value is that your decision making is based on best practice and the evidence that is available. And the action plan that we are being asked to develop at national level has to include these 5 actions, if you like. And the first one is about, at a national level, to enhance our One Health capacity, to strengthen our health systems as they currently stand. But in terms of the One Health, we have to look at emerging and re-emerging diseases. We have to look at zoonotic and vector-borne diseases. We have to look at the whole issue of food safety and better managing the risks from food safety. And that also includes food security, so production of food. We have to look at AMR. We've done a lot on AMR. And the last one is we have to integrate the environment into One Health. And I was interested in Hans' comment about, the environment should be our starting point. I mean, this is the way it's been presented at a global level. But the environment is there, and I think there's an acknowledgement that really the environment hasn't been considered as much as it could have been previously in the One Health space. And so the overall aim of having this plan at a global level is that we're better prepared, that we're better able to prevent, predict, detect, and respond to health threats, and thereby we will improve the health of our humans, animals, plants, and the environment in a sustainable way. So this really, I suppose, this covers everything we've been talking about today at this conference. So within the Department of Agriculture, I suppose our vision is to create an innovative, competitive, but a sustainable agri-food, forestry and seafood sector. And our mission is built around supporting the sector to deliver in a sustainable way and to deliver around the 3 pillars of sustainability. So at a social, economic and environmental level. And I work in the One Health, One Welfare stream within the department. And when we talk about One Health, I'm talking about One Welfare as well, because you can't separate health and welfare. And I suppose the way we look at the animal health sector is it's part of the One Health sphere, because you can't look at them in isolation. Because if we were to look at farmer well-being is dependent on animal health. Animal health will decide whether we have zoonotic risk. The environment affects animal welfare, which affects food safety, food security. So, it follows around. But basically what we're saying is you can't look at anything in isolation, and they are all intricately linked to the 3 facets of sustainability. So I'm just going to talk about the One Health journey, I suppose, we've been at a national level in Ireland. And I suppose the key area to talk about where we've really made inroads on One Health is antimicrobial resistance. So we started back in May 2015, and we established an interdepartmental committee which involved Department of Health, Department of Agriculture, with support from the EPA. And I really want to acknowledge the EPA's role in our whole One Health approach at a national level. So we launched our first National Action Plan in 2017 to address antimicrobial resistance. We followed on with a One Health Prescribers Conference. So this was to educate vets and doctors about the mutual challenges and, I suppose, the opportunities that are shared by both professions. So it was an education piece. We then published a One Health surveillance report. So this attempted to bring together human and animal data on resistance and also usage of antibiotics. So adopting that overarching One Health approach. And I think it's because we had such valuable input from the EPA into our action plan. We were seen as a country that had a One Health action plan because we cover the 3 sectors. And so we had a visit from the Commission in 2019. And then we're now into our second National Action Plan, which again is a One Health National Action Plan since 2021. And following on from that, we've expanded our One Health focus to establish a One Health Oversight Committee, which I'm going to talk about next. But I know there was a presentation on this last year. I think Derv Lamar's outlined what we're doing on antimicrobial resistance. But just to say, this demonstrates the value of collaboration and cooperation. We now have 150 actions in this action plan across human, animal and the environment, and also One Health actions. We've very successfully moved the AMR One Health agenda on. And the objectives in our action plan on AMR focus around these 5 key areas, if you like. Increasing knowledge and awareness. You can never do too much to educate and communicate on any issue. And so there's a huge amount of actions on that. Enhancing surveillance of both use in animal health and in human health of antibiotics, but also the surveillance trends. There's a lot of work to reduce the spread of infection and disease. This action plan focuses on disease prevention, particularly around the increased use of vaccines, because if you don't have sick animals or sick humans, you don't need to use antibiotics. So a lot of actions there, and a lot on the stewardship of antimicrobials. We have developed a lot of guidance around better prescribing practices, both in human and animal health, through this action plan. And the final objective was, I suppose, driving research, better diagnostics, quicker diagnostics, more access to vaccines and new medicines. So that's been our One Health approach to antimicrobial resistance. And there we are, the 5 objectives. So I just want to quickly talk in terms of research, where it's going at an EU level. And I think Marcus referenced the funding that goes on in his area. But just to say, under the EU for Health programme, there was 5.3 billion allocated at EU level. And this followed on from the COVID pandemic, that they wanted to better be prepared for the next future pandemic. So under that, Ireland managed to get 2 million for 2 projects. The first one is this one, the Jamarai project, which is looking at antimicrobial resistance. But the new change in this, because this is number 2, is that they've moved into the One Health space. They now want the research to be done across the 3 sectors in a collaborative way. So it is focusing on addressing AMR through the One Health focus, but the stewardship research is now being done at the human and animal health sectors together jointly, which wasn't in the previous Jamarai. And the infection prevention and control measures, focusing a lot around biosecurity, are being developed for both human and animal health. And then at the environmental level, they're also looking at infection prevention and control measures, looking at wastewater treatment, looking at the techniques for treating waste coming out of wastewater treatment plants, coming out of hospitals, and also looking at the whole area of manure and soil. So this is funding. This is a change in the mindset of funding at EU level. It's moving into the One Health space. And then lastly, in terms of surveillance, they're now looking to join up the environmental surveillance and also looking at in the veterinary side, looking at pathogens in terms of AMR resistance. And so it's very much integrating this One Health approach. The second project that we're leading on is this One Health Allies Pro, which is really a surveillance platform that's being developed. And I suppose it's to establish this multidisciplinary, again, this collaborative approach to One Health surveillance. And this is an all-island approach. So this is north and south. And it's to establish, the aim of the research is to establish a network, but to build coordinated surveillance for human and animal influenza viruses. Because it's highly likely that the next pandemic could be avian influenza. This high pathogenic avian influenza strain has now moved from poultry to cattle, and they have found it in dairy cows in the States. So we need to be ahead of the curve. This is a pandemic preparedness research program, if you like. We're also going to look at tick-borne encephalitis and establishing surveillance for the next unknown, the pathogen Y, and also to improve the surveillance systems that we have currently for zoonotic pathogens. So just wanted to reference, at a research focus, it is the One Health space is where we're going. So I'm conscious of the ESRI being involved here in this conference, and very much behavioural change has been a key focus for us in the AMR story. And I mean, it's a key focus for everything we try to do. It's all about change in behaviour. And we've looked at this a lot in terms of our action plan on AMR. And what we've seen is that policy can be a catalyst for change, and you can have all the regulation you want, but you must look at the individual and the interpersonal and the community relationships that people have. Because we got new legislation on veterinary medicines back in 2022, and it has been a game changer. We've reduced our use of antimicrobials in animal health by 22% in the last 2 years, because I believe the legislation has driven it on, but also the awareness has increased, and that has driven behavioural change. So you can't have one without the other. And we have built this whole focus on behavioural change into work we've done around antimicrobial resistance, and we have identified key interventions based on the research that we've done to change people's behaviour around how they use antimicrobials. So just to finally finish up on where we're at in terms of One Health. Last year we held this One Health conference in November. We started organising it in May, and then there was a decision to set up this committee in August, but we still had this conference, and we were very, very lucky to have some really high calibre speakers. One of them is here today, and he's in one of those mugshots, I think, on the right. But the purpose of this was to highlight at a regulatory and policy level that we needed to move to One Health. And key to this was getting our politicians on board, getting endorsement that this is where we need to go at a national level. So we have now established a One Health Oversight Committee. And what this committee is built on is collaboration and cooperation. This committee is going to be chaired by the Chief Veterinary Officer, Chief Medical Officer, and an Assistant Secretary from the Department of the Environment, Climate and Communication. So this is going to be a One Health Committee. So this committee is going to monitor and advise on emerging One Health threats. So I talked about possibly avian influenza, future emerging zoonotic and these vector-borne diseases. Vectors are a big issue in animal health. We have blue tongue travel from Africa across to the UK at the moment, and it's a real challenge, and what is driving that is climate change. Other objectives of this committee are to monitor and advise on antimicrobial resistance, on climate, on biodiversity, and certainly what Claire was talking about, we will have somebody from the National Parks and Wildlife Service on that committee. We will have the EPA. We will have, we aim to kind of, it's a very broad reach, but I suppose it's all about capturing the right people to deliver in a productive way. And we will also focus on food safety, food security. And one thing that isn't up there that Hans mentioned this morning that needs to get in there is the non-communicable diseases. So that will also be added in. And I suppose we will develop a One Health National Action Plan. This committee will oversee the development of that action plan, and it will include goals around collaborative surveillance, this whole idea of prevention, detection, risk assessment, risk management, risk communication, and also expanding the understanding and the linkages between all the One Health family. So that is the goal of that committee. I just want to quickly mention, because it was alluded to, the Green Deal and the Farm to Fork strategy, and I think it's important that we realise that the food production sector is doing a lot to address climate change. Food Vision 2030 it was a unique policy document when it came out in 2021, in that it looked at food systems. So it was a novel approach that we hadn't had there before. So it's about ensuring sustainable food systems. And it's built around those 4 mission statements. And the first one is about this climate smart, environmentally sustainable agri-food sector. It's also about supporting the resilience and the well-being of our producers, because I think it's really important to remember that what you pay for your food is substantially more than what the producer receives. So it's important that we're aware of that. It's also focusing on this, less of an emphasis on more cheap food, but on safe, nutritious food. That's where we're going. And I think the consumer is going to have to think again about what they can reasonably expect to pay for food if we are going to move into this climate-friendly food production sustainable system. And then lastly, I suppose there are just a few of I just wanted to highlight the One Health policies that we have within the Department of Agriculture. So our animal health surveillance strategy is built around surveillance of diseases in animals, but it extrapolates across to the human health sector. Our animal welfare policy, as I said, One Health, One Welfare. We protect animal welfare. We're also, that impacts on human health as well. We have a national biosecurity strategies where we look to control and prevent disease. We have a farm animal health strategy, which is built on prevention is better than cure. And then obviously we are working very closely within the Climate Action Plan. So I suppose all these policies demonstrate the recognition that you cannot look at animal, plant and environment health separately. They're all bound together with the health of the environment. And One Health needs to be implemented as a whole of society and a whole of government approach so that we can better address our health risks. One Health can help address the full spectrum of disease control from prevention, detection, preparedness, resourcing and management. And finally, I would like to say that I believe One Health should be seen as the approach for tackling complex societal challenges. And the One Health approach enables us to promote One Health for all. So thank you for your attention.